Right. Good morning, everybody. Welcome here to LSU Health Shreveport. We're delighted to see everybody this morning, and we're really especially excited to come together to celebrate an anniversary. In fact, a two-year anniversary. 2 years ago today, we announced the Emerging Viral Threats Lab here at LSU Health Shreveport that was open and fully operational to begin processing COVID-19 tests. As many of us, in fact all of us, will remember 2 years ago during that pandemic, it was very difficult, if not impossible, to get testing easily or accurately. And the the Emerging Viral Threat Lab really began to make that possible here in our region. This was made possible predominantly because of our expertise and our nationally and internationally renowned NIH-funded virologist, whom you'll hear from in a moment, and more importantly, the support of Governor John Bel Edwards, the Centers for Medicare and Medicaid, CLIA, the CDC, and many colleagues here within the state of Louisiana Department of Health, as well as across the country. The creation of the EVT lab was a collaborative effort from day one. It involved a plethora of people across the academic medical center, and it remains so to this day, as you'll hear in a moment. March 12th, 2020 is a day that'll live in infamy for me. I received an email from Dr. Andrew Urachko, who you'll hear from in a moment, and he had the idea that we could establish a lab to be able to do the testing for this pandemic. And in fact, at the time, I conveyed and conferred with our leadership and realized that indeed this was possible. 12 days later, the Emerging Viral Threat Lab became a reality, took its first sample in, and we were off to the races. Over the past 2 years, the EVT lab has grown and evolved to what we now have is the Center for Emerging Viral Threats. Oftentimes in the community, EVT and CEVT gets interchangeably thrown around, and that's because the EVT lab initiated what has now become the Center for Emerging Viral Threats. And more importantly, that EVT lab can process well over 3,000 samples a day, so that if and unfortunately when the next scourge or plague happens or pandemic happens, we'll be better prepared. More importantly, the importance of this new Center for Emerging Viral Threats, as you'll hear about in a moment, is going to be memorialized and contained within the new medical education building. And we have very exciting information and news to share with you today that I won't be telling you, I'll let others tell you. But I would like to introduce to you now Dr. Jennifer Carroll and Dr. Christa, who are both directors of both the testing lab and the sequencing lab, to tell you more information about the activities that they've been pursuing and doing.
Hi, everybody. Thank you for coming to celebrate this really special anniversary for us. I am Dr. Jennifer Carroll, and I oversee the reference lab where the COVID tests are processed. This lab would not be possible without the strong support of the administration here, the strong support of the Louisiana Department of Health, and so many of our friends here in this institution. I'm an LSU lifer, and so having the opportunity to do this, to see this mission pushed forward, has been really special. We're doing an amazing job, in my opinion. We are up to about 615,000 COVID tests in the last 2 years, and that's a really big number, something I'm not sure any of us expected to get to. Our positivity rate over that entire time span has been about 3%. We've gone as high as close to 40% positive when we were in the middle of surges. And now that we're in my favorite time, the troughs, where we don't have a lot of positives, we are under 0.5% positivity. And I'm going to turn the floor over to Dr. Queen.
Thank you, Dr. Carroll. During this time, the sequencing lab has grown and changed immensely, much like the variant landscape throughout this pandemic. So the sequencing lab supports the CEVT by determining the viral variants present within our community. Right now, we're still seeing most of the positive cases are attributed to Omicron, and it's attributed to the BA1 and BA1.1 lineages within Omicron. We are seeing a few cases every week of the BA.2 variant, which you may have heard about in the news. Importantly, also in the news lately are these recombinant viruses, and we haven't detected any in our area yet, but we're keeping our eye out for them, and we'll alert as soon as, if and when we see one in our area. To date, we've sequenced over 13,000 SARS-CoV-2 genomes and shared those publicly. And for an institution of this size, with the testing that we're doing, that's a huge number. We're the leading sequencer of SARS-CoV-2 within the state of Louisiana, and we're the top submitter within the state of Louisiana to public repositories.
And with that, we'll turn it over to Dr. Urachko.
All right, thank you very much. So I am here to, very excited, we have some really exciting news. So I'm very excited to announce that LSU Health Shreveport has been awarded $7 million in funds for the CEVT. This $7 million was secured by Senator Cassidy. So we really like to thank Senator Cassidy, his office, and his staff for securing these funds. I will explain in just a minute how these funds will support the CEVT, but briefly, I want to note that these funds will have a strong economic impact for our school. They'll allow us to recruit new faculty, allow us to continue and look to the future in the lab. It will really benefit the entire state as we recruit into the state and generate, these new faculty generate new funds to bring into the school. And so this is really a fantastic opportunity for the school and the state. So what are these funds going to allow us to do? For the CEVT, it's going to allow us to complete the building, to fill out remaining aspects of the lab. We're going to generate a BSL-2, or we'll build a BSL-2 and BSL-3 lab. I'll explain those in a minute. But I want to point out that these funds are not just to complete the lab, but they're going to allow us to look to the future. And that's really, I think, a key thing to think about, and something I'd like to highlight. If we've learned nothing else from this current pandemic, is that we have to be aware that infectious diseases are out there, and they remain really, if you think of all of our human history, have been a scourge for pretty much all of reported history. Just to give you some examples and things out there, probably in the last 2 centuries alone, more than 2 billion people have probably died from infectious diseases, so these are not trivial numbers. Just again, as a small example, smallpox, and really in just the last century, in the 20th century alone, killed close to 500,000 people, 500 million people. And again, these are not small numbers. These are huge numbers, and again, to think about the impact that infectious agents have had on the human population. So sort of knowing these ideas, I think it's key to think of that sanitation, antivirals, antibiotics, vaccines have been probably one of the things that have most importantly improved human health, at least overall human health. And what we want to do in the lab is to look to the future, that knowing that new discoveries, new antivirals, new antibacterial agents, new antiparasitic agents, new drugs in this field are going to be important as we go forward. And this lab will prepare us to make some of those discoveries. And what the CEVT will have is a new BSL-2 and new BSL-3 labs. These labs will allow us to hire new faculty into the state, to invest more towards research, which will grow not only the school but also the state, and allow us to think about both existing pathogens, flu, and other viruses that cause cancer, viruses that cause birth defects, as well as emerging pathogens, and as well as provide a center here within the state to continue to surveil or note emerging pathogens or any other agents that should come up. This in turn, as I just sort of pointed out, will positively impact the economy of the state through these new faculty hires and the expected income or grants that they will secure, bringing again that to the state. So what are these labs? BSL stands for Biosafety Labs, so 2 or Biosafety 2 allow us to work in a controlled, safe environment, obviously following certain federal and state guidelines as well as school guidelines, where we can study viruses that cause cancer, viruses that cause birth defects as examples.
These labs, again, will allow us to expand our research and grow our campus, adding new funds to the state, as well as really add national, international reputation to our campus and the state. We'll also add a new BSL-3. This is a high containment facility, and it's important to point out that this is where we can work on flu, coronavirus, and certainly other emerging pathogens. We've already been able to hire new faculty into this space, so this is exciting, and having this new lab will really allow us to expand those opportunities. These labs will be modern, as mentioned above, give us capabilities that not all schools have, and really put Louisiana on the map. Again, to allow us to recruit new faculty, as well as enhance our national and international reputation, and that in turn will certainly grow the economy of our state. And I'll end with just simply, again, thanking Senator Cassidy for allowing us to securing these funds, allowing us to be awarded to LSU Health, and allowing our lab to grow. And I just will end with the last comment saying I think this is really an unprecedented opportunity for our campus and our state to really grow and become a national, international leader in this field. And I think it's something that we should all be very proud of. And so again, thanks to Senator Cassidy and everyone else who's been involved with this. So thank you very much.
Thank you, Dr. Urachko, and thank you, Dr. Queen and Dr. Carroll. I think as we've all heard here today, the impact of both the Emerging Viral Threat Lab and CEVT has been just tremendous. And in fact, in closing, I'll kind of retell a story that I think will be indelibly marked in my mind forever. And in fact, it was in the pace and the throes of putting this lab together with Dr. Urachko, Dr. Carroll, Dr. Rona Scott, many others. And we were hearing from nursing homes and assisted living facilities to be able to take tests and help them identify individuals that may be ill. It's hard to remember that kind of crisis and that kind of intensity, but it was very real. It was so palpable and it was stunning. And actually, again, I would like to thank everyone that's been associated with the EVT and CEVT efforts. This has been truly a community event that now provides a safety net and a safeguard. And more importantly, thank you, Senator Cassidy. With your support, this is going to now ensconce the CEVT in the new building to be able to do not only education, but surveillance, as Dr. Urachko said. So thank you all for coming out today. I would like to tell you there's cake and drinks outside. Please come have a slice. And if anybody has any questions, individuals will be available to answer questions here one-on-one. Thank you very much.